Going cool, na? What?
Nothing.
Come on, Shruti. Tell me what happened.
That is the point, Saurabh. Why does everything need to be told? We are in a relationship since last 3 years. Then why are we avoiding the next step?
Okay. So this is what you are thinking. Shruti, can we discuss it some other time, please?
No. Just leave it. I don't want to talk about it. I already know your repetitive reasons. Just leave.
Shruti. Shruti, you know it very well that how conservative they are. All I'll say that they need time to accept you. That's it.
Saurabh, you know what? First you will have to accept me, then only your parents will. Well, I will not make fool of myself anymore. Just leave for good.
Shruti,
Saurabh? Saurabh? Just get up, Saurabh. What? Saurabh? Saurabh, say something. Saurabh, get up. Get up. Hello, emergency? Please, Saurabh. Please say something, Saurabh. Please get up, Saurabh. Please say something. Please.
Tell me the vitals. And O2 saturation. Okay. What time am I expecting you here? Okay. Okay. Yes. Where are you right now? Done. All right. Yes. Yeah, bye.
Hi, I'm Dr. Varun Singh. I joined today.
But wasn't Dr. Siddharth supposed to continue for another week?
Well, I don't know about that, but I guess from now it's just me. You are?
Dr. Ritu Sani, anesthetist?
That's interesting, because I was just going through this Facebook page made by this anesthetist who keeps posting fun stuff. And doctor, you have to go through this page.
Doctor, I don't have time right now. I'm in a little hurry. And we can talk about this fun stuff a little later. There's an emergency.
Emergency.
Yes.
Let's get to it then.
You get the ER ready? I'll take the lead. What's the case?
Saw male 27 chest pain since last 4 hours.
One episode of vomiting in the ambulance and one at home. Maintaining his tests on O2 at 10, BP is dropping, pulse is feeble, pupils are reacting, blood sugar is normal. Started him on EPI drip.
Saurabh. Saurabh, say something. Get up, Saurabh.
Saurabh, can you hear me? Saurabh, get ready for research. Hurry up. Come on, people, let's move it.
No, Cepidose 5.
Steroids? No. VT, we need to shock. Charge 200. Everyone clear?
VT again.
We need to shock him again. Charge 200. Everyone clear? Steroids?
Pulse is there.
Check the vitals. Maintain the blood pressure. Connected to the ventilator. Call the cardiologist to come take a look. I need blood gases in an hour. And send off all the other cardiac markers. That was pretty close.
Did you observe the ECG and the oxygen saturation?
Yeah, that's why I said it was pretty close.
Who's in charge of this case?
Dr. Varun is the new in charge of emergency.
Hi, sir. Nice to meet you.
For how long have you lost the pulse?
5, approximately 6 minutes.
Tell me clearly, 5 or 6. Don't you know how critical it is for the brain? Do you know after how many minutes brain ischemia occurs?
6 minutes. After 6 minutes.
Has someone spoken to the family? Call for Dr. Sumit. We need to assess the patient. We also need to see the possibility of brain damage due to hypoxia. Shift the patient to cath lab. We need to do angiography. We might also have to do PCI. I'll be waiting there.
PCI. But the patient is just 27.
Can't you see the ST elevations? Don't you understand this could be an acute infarction? There might be a history of alcohol or smoking. We might have to stent him. Can we get going, please? Fast?
Yes, sir.
We also need to speak to the family.
Yes, doctor.
Fast.
Congrats, doctor. You stole the show. But if I'm not wrong, he's the famous cardiac surgeon, Dr. Devendra Khatri, right? I mean, but what's the matter with him? Why was he so annoyed? I mean, come on. We saved a life in there. The least he could have done was appreciate us.
Wow, Dr. Varun. You have some unrealistic expectations. Dr. Khatri will barely use words of appreciation even if you find a cure for cancer. We are doing our job and that's it, nothing to be thanked for. That's what he thinks. Hi, my file please.
Yes.
Did you inform Dr. Sumit Roy?
Yes, ma'am, he is always there.
Okay, thank you.
You know, men can suffer from midlife crisis. Maybe this is his. So, are there more people like Dr. Khatra?
Can you stop doing that? Just stop it.
Stop what? Oh, come on, it's just a joke. Don't you have a funny nickname?
No, I don't have a funny nickname.
Dr. Sani,
Dr. Sumit, quite prompt.
where's the patient?
We are heading the patient to the cath lab and Dr. Khatri is planning to do an angiography, but we may put a stent as well. But he also wanted to take your advice before we take any further decision.
Can you brief me on the events? What were the blood oxygen saturations like and how was the trend of his BP?
So Dr. Varun will be filling you in with all the details. Now, he's the new in charge of the ER. I would have to go for now, consents and all, and also that I can't miss Dr. Khatri's procedure.
Or else there'll be a Khatra.
Thank you, doctor.
Hi, I'm Dr. Varun Singh.
Dr. Sumit Roy.
Doctor, why is everyone so hostile here?
No, it's not like that. But if you make fun of the father in front of his daughter, anyone will snap.
What? They? Father and daughter? No. But she's Sahani and he's Khatri.
Don't even go there.
Oh, so there's a history there.
There is always a history, and one should never skip it. Anyways, ABGs seem fine.
Okay.
I shall re-evaluate the patient later. We may need an MRI and EEG if he doesn't wake up.
Right.
So let's watch.
Yeah.
He was not doing so well, but you already know that. He is stable for now, but is still very critical. What I'm trying to say is that there might have been a blockage in some critical artery, and that could have caused this entire mess. So we need to do the angiography, and we might even have to put a stent, okay?
Ma'am, would you please sign on this consent form on behalf of your husband? May I know what's your relationship with the patient?
I'm his.
It's okay. I understand. But we need to do this procedure, okay? So you need to call the family. And don't worry, he's at the right place. Yeah?
Hello? Hello? Auntie Shruti this side. Yes, Saurabh's colleague, yes.
What?
How did you know that she was his girlfriend? I mean, why not friend, cousin, sister? Did she tell you?
Well, not everything needs to be told. Some things can be judged. And who would know better than doctors? Right?
Right. But you may be wrong. What if you're wrong and then you put yourself in an embarrassing situation?
Well, that's a risk that I'm willing to take. Usually I'm not wrong.
So what about me?
What about you?
You know what I mean.
Well, you are the girl who wears her heart on her sleeve and is very easily impressed. And I'm pretty sure that in few days, you will be looking at me the same manner that you look at Dr. Sumit.
Right. Like that's going to happen. No way.
So you can smile, huh? So listen, remember this Facebook page that I was telling you about? The one made by this anesthetist? I mean, come on. It is so funny.
I am genuinely not interested in that Facebook page. Please.
Catheter ready?
Yes, sir.
Inject the dye. There's a blockage in the right coronary artery. Stents, please. How's everything there, Dr. Ritu?
Everything under control, doctor.
Prepare to move the patient to the ICU.
Okay, doctor.
Both his pupils are reacting well and his BP is also stable. But a complete analysis can only be done once he's fully conscious. Keep me reported on his conditions.
Sure, doctor. Thank you. Don't worry. Your boyfriend will be fine.
So you understand my point, Saurabh? You need to leave smoking and you have to change your lifestyle. And we can help you with that. We have a lot of program running in our hospital.
Sure, doctor. I'll seriously consider that. Thanks.
You're Shruti, right? Thank you so much, beta.
Shruti, look, everything's fine now. He's out of all the major complications and he's perfectly fine. But the only thing I want you all to do is that he has to continue a few of his medications and he has to keep in touch with his cardiologist. That's all what I want.
We can't tell you, doctor, how much we owe you. We are really short of words to express our gratitude. Thank you so much, doctor, for saving my son's life.
If you have to thank, you should thank Shruti because she's the one who got him here and she's the one who's been present at his critical time.
Yes, beta. We'll be grateful to you for our entire life. You have been with Saurabh in our absence. I'm sure you must be missing on to a lot of important time and work. So now that we are here, you go home, take rest. Thank you so much.
Shruti, please wait. Please, don't leave. Please. Mom, Dad, Shruti is not just a friend or colleague. Actually, Shruti is my girlfriend. And we are in a relationship from last 3 years. Yes, Mom. I really don't know how to make you understand. I was just trying not to face this situation, Dad. But Dad, Mom, I can't deny it further. And I hope you'll also accept her.
We have to leave the patient alone for some time.
A key to many medical procedures, like transplants, is acceptance. We, as doctors, know how important it is. Our bodies, however, sometimes tend to reject it, and this can lead to disasters. So in life, accepting a few facts can make at least a few threads sorted. So there's a new joke, huh? When a man asks an anesthetist, what do you do? He says, I pass gas for a living. Huh? I mean, come on, how funny is that? I pass gas for a living.
Dr. Devendra Khatri is my father. And whether I like him or not, I don't care. But I don't want you to crack jokes on him in front of me. Do you understand? And by the way, that joke was very lame.
And sometimes this acceptance can surprise us, leaving us more perplexed.